Good evening, everyone. Am I audible clearly? Can anybody please confirm?
You are audible, ma'am.
Yeah, okay. Thank you. So, today would be the concluding session for our course. And so, we have gone through all the different topics of the lectures through the various problem solving sessions. So, today, what I will do is I will discuss specific problems again. So, that will give you an idea as to what kind of questions you can expect for your examinations. So you can just recapitulate all that has been discussed you can go through the slides of our previous sessions, and also revise the questions of the assignments. So it will help you in your examination, right? So let us just go ahead with the questions. So we'll just quickly recapitulate all the concepts that we have gone through. So these are the questions that most of them we have already discussed, the concepts that we have already discussed. So I want all of you to participate and voluntarily give the answers to these questions so that we can have an interactive session for all these questions, and we can just skim through them very quickly. So question number 1: when is football hold for breastfeeding primarily recommended? So please go ahead with the answer. We have gone through these concepts, so I know you people know the answers. Okay. I want all of you to come up with the answers.
Option A.
It's option A.
Right. So all the questions that we'll be discussing today, so from there you will get an idea as to what are the important concepts that you need to remember, right? So yes, option A is the correct answer. That is, football hold is easy. I mean, football hold is the preferred method, or it is the recommended method of breastfeeding in case where a mother has twin babies. So please go through the different positions of different breastfeeding positions, and whether it's cross cradle hold, and then football hold, laid back position or sideline position, and what are the indicated situations in which these positions are recommended, right? So as the name says, football hold, so obviously it's, as we have discussed before, like holding a football, the position in which like we hold the football, it's similar to that, and it's useful for a mother who has twin babies, so she can cater or she can care for both her babies simultaneously, right? So yes, the answer is option A, when the mother has twin babies. So question number 2: mother complains about reduced breast milk supply. What could be a possible reason among the following?
Option D.
Correct. So
Point number D.
yes. So we'll just keep on revising these questions so that it is easier for you people to, be prepared for your examinations. So as we have discussed this before also, let us just go through the options. The question says that the mother complains about reduced breast milk supply, right? So option A says first time mother. So that doesn't make sense. Small breast size, we know that there are a lot of other factors which determine the breast milk supply. So definitely the size of the breast is not a direct determinant for the breast milk supply, right? Not using a nipple shield. We have learned that using a nipple shield is rather disadvantageous, and it is recommended that the mothers, they do not use a nipple shield. Option D, poor latching or nipple feeding. So yes, if there is poor latching or nipple feeding, so in that case there won't be a deep attachment of the child's mouth to the mother's breast tissue, and the whole process of breastfeeding will not happen adequately, and hence the whole cycle that we have learned, that demand and supply, so the baby won't be able to take in the milk, and obviously that might lead to the reduced breast milk supply. So yes, the option D is the correct answer, poor latching or nipple feeding. So Question number 3. What does a calcium deficiency in pregnant women result in?
Option
B.
B.
Option B.
Right.
High blood pressure.
Right. Yes. So, calcium deficiency, if a pregnant lady is deficient in calcium, so definitely there are higher chances of that mother developing hypertension, right? So, high blood pressure is the correct answer. So please remember, whenever you are going through your previous sessions or whenever you are going through the previous lectures, keep in mind as to what essential what are the nutrients, the deficiency of which can cause very significant which might have very significant outcomes. So be it in a pre-pregnancy phase or in women and also in children. So what are these the nutrients which are causing specific deficiencies? So please recapitulate all these kinds of deficiency conditions that are related to both the mother and the child, and what could be the consequences of that severe deficiency, right? And if there is a deficiency, so definitely that has to be made up with external supplementation, or most advantageously through the diet, right? So we'll move on quickly to our next question, though I know all of you already know the answer. So let's
It is
just
C.
yeah. What about others? So today I'll just quickly repeat, since a lot of new people have joined. So we'll very quickly go through the questions, and these are the concepts we have studied throughout all the sessions. So I want all of you to be very interactive today and be very prompt with your answers. So question number 4. In the longitudinal position for skin to skin contact, the baby's chest, abdomen and legs should rest on which part of the mother's body?
Option C.
Okay. What about the others?
Yeah, this is option C.
Right. So, exactly. So, option C, the lower chest and the upper abdomen. So, as we know, whenever we are trying to achieve the proper placement of the baby's mouth to the mother's breast, the exact or the ideal position or the ideal part of the breast which should be in the baby's mouth is the lower border or the lower areolar part, right? And accordingly the baby should be positioned in such a way that the baby is longitudinally placed over the lower part of the chest and the upper abdominal area of the mother. So that is the ideal position for an optimal skin to skin contact in between the mother and the child. So please go through the previous sessions also, where we have talked about the positions and which are the ideal positions in which all of these we have already discussed, right? So next, which fats help to reduce the risk of premature birth? So we have over and over again emphasized on the
Omega-3.
importance of, yes,
Omega-3.
omega-3, right? So over and over again we have emphasized on the importance of good fat. We have talked about saturated fats, unsaturated fats and also trans fats, right? So trans fat is something which is not desired, and saturated fat, among that, omega-3 fatty acid is something which is very essential for the growth of the baby, and it is also a very important nutritional component in our diet. So quickly, please somebody tell me which are the 2 omega-3 fatty acids that are present in breast milk?
EPA, DHA.
Right, yes. So omega-3 fatty acids, these are the 2 omega-3 fatty acids which are exclusively present in the breast milk, EPA and DHA, and hence it is also most significant for the growth of the child. So omega-3 fatty acids, we know that the hind milk which is present, it is fat, it is rich in fat, right? And that is important for the brain growth, the retinal development of the child. So please remember, it is always the good fats which are absolutely necessary for the growth of the child. So whenever we are talking about fats, many a times we say that okay, fat is disadvantageous, fat is not required, fat is always bad. But definitely fats also have a good part, and these are the good fats that need to be meticulously incorporated into the diet. So very correctly said, omega-3 fatty acid. Okay, so next question, presence of what is important for the absorption of vitamin B12 in the intestine?
Option C, intrinsic factor.
Right. So intrinsic factor. So I would like to ask you, why do you think we are so much concerned about vitamin B12? What is so important about vitamin B12? Can you tell me two important, significant roles of vitamin B12?
Neural tube defects and anemia.
Correct. So vitamin B12 is it has a very significant role in the development of the fetus. So in case there is deficiency or there is marked deficiency of vitamin B12, folate and choline, this can lead to the neural tube defects. We have studied about this, we have discussed about this, that how there can be brain defects and also there can be spinal cord defects while the neural tube is developing. So vitamin B12, number one, it is very essential for the neural tube development of the baby. So the brain development and the spinal cord development. Number two, the most common one, apart besides iron deficiency anemia, vitamin B12 deficiency is one of the most common causes of anemia. So hence, vitamin B12 is very much necessary to be present in our diet, and it is not only that it is sufficed if it's present in the diet. Anything if we take through our diet, but if it is not absorbed properly in the body, then its effect will not be seen, right? So hence in our body we have something known as intrinsic factor, which is being secreted in the stomach. So this intrinsic factor, it gets secreted in the hello, good evening, yeah. So it is secreted in the stomach, and this intrinsic factor, it helps in the transportation and also the absorption of vitamin B12 in the intestine. So we have a very definite gastrointestinal or digestive mechanism which is happening, and all the food that we take in, they have to be properly absorbed in the intestine, right? So if it is not absorbed, then of course we cannot take the advantages of that food. So yes, intrinsic factor is very important, because as I just said, they help in the transportation of vitamin B12 to the intestine, and they help in the absorption of in the absorption of vitamin B12, especially in the ileum, right? So very correctly said, it is the intrinsic factor. So we'll move on to our next question. Which of the following is not correct in the position of the baby's body during breastfeeding? Okay, so if you have any questions regarding exam, you can just put in the chat box and we'll come back to the questions after the class, okay?
Option D.
Yeah. So can anybody tell me what should be the ideal position of the baby when the breastfeeding is done? So here it's written, nair of the baby's nose should be above the mother's nipple. So you are saying that this is not a correct position. Then what is the correct position? Anybody can just go forward.
It should be in line with the mother's
Right.
hip.
So it should be a nair to nipple position. So the nair of the baby's nose should be in line of the mother's nipple. So it should be at a similar level, right? So very correctly said. And as we see, baby's ear, shoulder and hip should be in a straight line. So whenever we have seen in the different breastfeeding techniques, like whenever the baby is being held, this criteria has to be fulfilled, that the ear, shoulder and hips should be in a straight line, right? Also, the baby's stomach should gently press against the mother's chest. We have just discussed as to what should be the proper, preferred position of the child for optimal skin to skin contact, right? So that is, as we just discussed, the lower chest area and the upper abdomen. So the baby's stomach should also rest on the mother's chest. C, mother must support the baby's entire body. Of course, so the baby is just a tiny organism, so hence the mother should support the entire body of the baby. And of course, as we just discussed, it is a near to nipple position which is most ideal. So yes, option D is the correct answer. Now question number 8, deficiency of which nutrient during the first 1000 days leads to impaired learning, impaired social emotional behavior, and higher levels of anxiety and depression later in life?
Iron.
Yes,
Option B, iron.
correct.
The iron.
Absolutely correct. So we have learned about the significance of the first 1000 days exclusively, and we have also seen why this iron is so important. So whenever you start talking about iron, you go back to the pregnant mother when she needs a lot of iron. So, and after that, it is also, you recapitulate about the delayed cord clamping, which is essential so that the iron reserve of the child can also be maintained, right? So the mother is passing on the iron reserves to the child, because this iron is very, very important for the cognitive development and also the other kinds of, psychological development of the child. So it is very important that the proper iron reserve is also maintained in the child. So yes, as you have said, that iron is the correct answer. Apart from that, please go through as to what is delayed cord clamping and what are the ideal times. We have discussed about these, and what is the essentiality of delayed cord clamping and why the iron supplementation is so important, right? So if a mother is iron deficient, so obviously mother is suffering from anemia. But apart from that, if her iron requirement is not being fulfilled through diet or through supplementation, then obviously that will directly impact the child. So hence the iron supplementation is also very important. So hence the prenatal, the iron and the folate supplementation program is also there. So while you are practicing all these questions, please go through the other related questions as well, right? Okay, so we'll move on to the next question. What kind of foods, even in large amounts, can cause hidden hunger?
Point B, nutrient poor foods.
Right. So whenever we are talking about the kind of foods, so we have something as energy rich foods and something, yeah, option B. So there is a category of food which are very high on energy and high on calorie, and something which is the bodybuilding food. So these bodybuilding food or these minerals and vitamins, they are more on the nutrient quotient. They supply more nutrients. And the other calorific food or the energy giving food like carbohydrates and fats, they are more on the calorie side or the energy side. So what happens like if these nutrient poor foods like carbs and fats are taken more in amount, so even if a lot of amount of these nutrient poor foods are taken, but that obviously won't satiate the individual, that won't satiate the mother or even the child. So it is very important to have a proper balance between both the energy rich food and also the bodybuilding food or the nutrient rich food, right? So yes, the nutrient poor foods, if taken even in large amounts. No matter how much the person eats, still it will cause hidden hunger, and the person will keep on feeling hungry, and he or she will not feel satiated, right? So it is very important to take in the nutritious food in a balanced way. Okay, so option B, nutrient poor foods is the correct answer. Okay, so question number 10, what other food and fluids can be given to a baby under 6 months of age?
D.
Option D.
Right. So, as we have discussed, that any baby under 6 months of age obviously has to be exclusively breastfed. So, all these concepts that we have been talking about for so many weeks, initiation of breastfeeding, exclusively breastfeeding, and complementary feeding, so all these are very important at specific age and specific time for the growth of the child. So a baby under the 6 months of age, it is the breast milk which is giving the optimal nutrition to the baby. So obviously, as we have discussed before, fruit juice, we won't really advocate fruit juice for a baby. Even if during complementary feeding fruits need to be given, it should be whole fruits, right? Rice water, no. Little water, no. Of course, nothing except breast milk. So any child who is under the 6 months of age should be exclusively breastfed. And on the completion of 6 months of age, there should be the starting of complementary feeding, because from that time the baby's requirement changes. The kind of nutrient and energy and protein requirement that the baby's body needs, it will be obviously amplifying, and hence that is the time when the shift needs to be done to the complementary feeding, right? So yes, nothing except breast milk. We'll move on to our next question. The IMS Act is considered violated if a food is promoted by any means, specifically for children up to how many years of age?
2 years of age.
Right. So 2 years of age. So the IMS Act, it is considered violated. So nobody can advocate that these food substitutes or milk products, they are beneficial or they are advantageous for the babies, and they should not advertise it into the media, and these are entirely contraindicated to be told to mothers, to be told to be given to babies, to be given to babies through healthcare workers and other professionals. So this is an out and out violation of the IMS Act. So after I covered the questions, I'll be touching upon a little bit on the IMS Act, since one of you had a query regarding it. So please remember that it is a complete violation of the IMS Act if the food substitutes or the infant food substitutes, they are being advocated to be given to children below 2 years of age. So definitely the complementary feeding phase should be maintained for a child after the completion of 6 months to 2 years of age, so that the child gets the optimal kind of nutritional requirement, right? So yes, option B is the correct answer. Next, it is said that malaria is a risk factor for iron deficiency. Why?
Option
Blood
C.
cells are damaged.
Right. So as we know, malaria is a condition where the RBCs are being affected. So it is the cycle where the RBCs are being destroyed by the malarial parasite. So if the RBCs are being destroyed, so definitely the iron deficiency, anemia can happen. So we know that there is hemoglobin and there is iron which is being associated with hemoglobin and blood. So if there is
Courier cover.
yes. Okay, so if there is malaria, so definitely that is a risk factor for iron deficiency anemia, right? iron deficiency, and that might lead to that obviously will lead to iron deficiency anemia. And we know that anemia is also associated with a lot of other complications. So yes, the answer to this question is red blood cells are destroyed in malaria. Okay. So the next question, the mother brushes her nipple on the baby's upper lip for more than 10 minutes, but the baby doesn't open its mouth widely. What should the mother do?
Option C.
Okay, what about others? Yeah. So option C is the correct answer, which says don't feed as the baby is not hungry, right? So as we have discussed, there are something called as hunger cues, right? So there can be early hunger cues, and these baby presents you with these hunger cues, which indicates that okay, now the baby is hungry and the baby needs to be fed, right? And if you don't catch these hunger cues or the hunger signals, then the baby might get agitated and start crying. So hence it is very important that you identify these hunger cues, and also while going through these concepts, please go through which are the early hunger cues. How does the baby communicate with you, trying to tell that okay, I am hungry now, right? The baby will open his or her mouth, try to look from side to side, and also might put his or her hand in the mouth. So all of these are early hunger cues, and this is the mechanism as to how the baby is telling okay, now I need the food. So if the baby doesn't open his or her mouth, that means he is now satiated and he doesn't want to eat. So hence, in spite of the mother trying to stimulate the baby for breastfeeding, the baby doesn't open the mouth widely. So that is an indicator that the baby is not hungry, and the baby should be fed only and when he or she is hungry. So yeah, so before going on to the next question, I would just like to ask you people, what is the usual frequency of feeding the baby in a day, the daily frequency?
10 to 12 times.
Correct. So it is ideally 10 to 12 times as to how you should be feeding the baby, though it's obviously as how the baby demands for it. And at night it is around 3 to 4 times.
3 to 4 times.
Correct. So please remember the frequency as to how the baby needs to be fed. Okay. So we'll move on to our next question. A mother feeds an expensive formula milk to her baby, yet the formula does not protect the baby. Why?
Point A.
Option A.
Okay. So option A, formula feeds do not have antibodies, living cells and good bacteria, thus resulting in increased risk of infection. Very correct. These formula milk, they do not have these infection fighting components which the breast milk has, right? So can anybody tell me what is the antibody which is present in the colostrum? Okay, what is colostrum?
First milk which comes, the yellowish
Right.
gold.
So colostrum is the first milk which comes out, and it is very rich in these infection fighting proteins, and that gives the initial immunity to the child. So yes, immunoglobulins G, M and A, they are present, but it's mostly IgA which is
A.
which is present in significant amount, right? So breast milk, it has got antibodies, and also it has got some other factors which leads to the overgrowth of some beneficial bacteria. So can anybody tell me which is that factor which is present in breast milk that leads to the growth of good bacteria in the stomach?
IgA.
No, I'm asking which is the factor. So we have, IgA definitely.
Bifidus.
Yeah,
Bifidus.
Lactobacillus bifidus.
right.
Bifidus. Lactobacillus bifidus.
Yes, correct. So bifidus factor is the factor which is present in the breast milk, and it is very essential, or it is very helpful in enhancing the growth of the beneficial bacteria which is lactobacillus um, uh, bifidus, right? So the bifidobacterium. So that is an it's a commensal bacteria. It's a good bacteria that grows in the GI tract, and hence these components, they are present in the breast milk, and hence they are important. Yeah. So since they are present in the breast milk, so it is very important that the breast milk be given to the child, right? So as we know that it is colostrum is the first milk which should be definitely given to the child. And can anybody just tell me what is golden hour?
The first after baby's
The first hour.
Yeah. So the first hour within which the colostrum, yes, feeding within the first hour of birth. Okay, it's not the first 100 days. Golden hour is not first 100 days. It is the first hour within which the baby should be fed the colostrum. And as we know, yes, the colostrum is very rich in the infection fighting components, and we have just discussed about what are these components. They could be antibodies, they could be these factors which help in the growth of the good bacteria in the body, right? So yes, the answer to this question is formula feeds, they do not have antibodies, living cells and good bacteria. Thus it will result in an increased risk of infection. So when these are given to the child through colostrum, through breastfeeding, so of course mother is passing that immunity. That is the innate immunity which the child is getting, right? So hence the child will be secured from the different kinds of infection that might happen initially. Yes, somebody has raised a hand. Please go ahead.
Yes, ma'am. Cesarean mother can't give milk and first golden hour, no? First hour.
Sorry?
Cesarean mother.
Yeah, so the thing is, cesarean mother can still give. I mean, it is the colostrum can still be given, and it is not an absolute contraindication. So hence, it can be given. Right? Okay. So we'll move on to the next question. A baby is severely malnourished, yet the malnourishment is masked. What could be the reason?
A, stunting.
Right. So what do we mean by stunting?
Short stature.
Short height.
Okay. So short height as to
Age.
age. Correct. So please remember these parameters, right? And what is wasting?
Is like wait for age.
Wait for height.
Wait for height.
Wait for length or height.
Correct. Correct. So here, as we can see the options, it says high lean mass. So of course, high lean mass is something that we all, it is beneficial, right? That it is less amount of fat in the body and it is more of lean mass. So definitely it is not something related to malnourishment. Proper complementary feeding and proper breastfeeding obviously won't lead to malnourishment. So if a baby is severely malnourished, so the stunting can also mask that condition. So since the baby is shorter in height as compared as related to his or her age, so that can mask the chronic malnourishment or the kind of malnourishment that the baby is having. So yes, stunting is the correct answer. So we'll move on to the next question. How wide should the baby open its mouth before the mother puts the breast in it?
Option D.
120 to 160 degrees.
Right. So as we know that for the proper latching and for the proper deep attachment of the breast tissue into the child's mouth, there should be a wide opening. And a wide opening, there should be a specific angle between the two lips of the child so that it can open widely and then latch onto the lower areolar region to properly during breastfeeding, right? So the optimal angle which is to be achieved is more than 120 degree, right? So whenever we are talking about, the angulation, yeah. So 120 degree is definitely an obtuse angle. So there is more room for proper attachment. So 120 degree to 160 degree is the ideal angulation at which the baby's mouth should be open to get a proper latching onto the breast tissue. So yes, the correct answer is option D, 120 to 160 degrees. So we'll move on to the next question. A child has severe type 2 nutrient deficiency. Mother increases the quantity of the previously given food without improving the quality of food. Will it help? What do you think?
Option B, no.
Right.
No.
So what is a type
No.
1 nutrient deficiency? What is the difference between type 1 and type 2 nutrient deficiency?
Type 1 are the functional nutrients and type 2 are the growth nutrients.
Right. So in type 1 nutrient deficiency, we have the deficiency of the functional nutrients, which are related to, the maintenance of the functional metabolism or the functional activities in the body. And type 2 nutrient deficiency happens when the growth related nutrients are deficient. So there is no permanent store of these, type 2 nutrients in the body. So to have that proper growth ongoing, that has to be given through the diet. So now if mother keeps on increasing the quantity but the quality of food is not changed, so we have just discussed that for growth, both the energy rich food and the protein rich food along with vitamins and minerals, it is essential. It is not that only energy or calories are to be given for the proper growth. It is also proteins, which are the bodybuilding food, and vitamins, minerals, which are also, they act as nutrients which are helping in the proper growth. So as we know that carbohydrates, protein, fats, these are all macronutrients, and these are essentially leading to the proper growth along with the different vitamins and minerals, right? So of course a balanced meal is required for the proper growth and development of the baby. So it is not only the quantity of food but definitely the quality of food which needs to be more focused on. So whether all kinds of food have been introduced into the meal, and what is the amount of each, what is the ratio of each kind of food which is being given. So we need to remember it is the quality of the food which is being given to the child, and that will ensure a proper growth and development cycle. So we'll move on to the next question. Food fortification is used to prevent or treat which nutrient deficiency?
Type 1.
Right. So can anybody quickly tell me what do we mean by food fortification?
It is about adding a nutrient which is not present in the food.
External addition of.
Right.
Like adding iodine to the salt.
Right. So any food which naturally doesn't have a component, what we are trying to do, we are adding it additionally into that food so that the specific nutrient can also be fulfilled through the diet. So that is food fortification. So if we face a type 1 nutrient deficiency that we were talking about, right? So the functional nutrients. So to treat these functional nutrient deficiencies, the best way would be to fortify the foods, say a vitamin deficiency. So, and the example that has been given, the iodine deficiency. So if these are being incorporated into the foods which are naturally devoid of that specific component, so that will help in treating those kinds of nutrient deficiency. So yes, type 1 nutrient deficiency is the answer. Okay. So next question. A nurse explains the benefits of delayed cord clamping to a pregnant lady. What do you think could be the benefits? So we have just,
Option 4.
Option 4.
Right. So we have just discussed about delayed cord clamping. Correct. Option 4. So it helps to improve iron storage in the liver. So we have talked about delayed cord clamping and why it is so important, because at the initial stage, obviously the baby won't be having anything, any reserve of his or her own, right? So whatever he or she is getting is from the mother. So be it the immune factors, that is the infection fighting factors, or be it the other nutrient reserves. So these are all being passed on from the mother to the child, and hence the delayed cord clamping is one such phenomenon which increases the which increases the chances and the maintenance of the iron reserves in the child's body. So hence it is very significant, so that the iron level properly can be maintained in the child's body. And what we have also learned, that the iron is important for the cognitive development of the child. So of course, not only for the mother but also for the child, iron is something which is indispensable, right? So apart from the cognitive development, there are other bodily functions which also is affected by iron. So in the mother, as we know, iron deficiency anemia is most common, right? So it is also the different kinds of manifestations that can happen in the mother because of iron deficiency, and this can also be reflected in the child. So if mother is iron deficient, so it is very necessary to start the mother on iron rich diet or iron supplementation, so that the thing is not being reflected onto the child. So the child needs to have a proper reserve of iron, because for the first, we have studied about the first 1000 days, which is very important, right? So at that time the iron reserve needs to be maintained, so that the proper growth and development of the child's brain and the other functions, they occur properly, right? So yes, delayed cord clamping, it helps to improve iron storage in the liver. Okay. So some babies, they do not have access to breast milk at all. So we know that breast milk is indispensable, right? We are advocating that breast milk should be, initially, the initiation should be within the first hour of birth, and then the baby should be exclusively breastfed, right? But what if the access is completely nil in case of some babies? So how can the benefits of the breast milk be incorporated, right? So yes, what are the answers?
500 ml of animal milk twice.
Right. So,
Breast.
correct.
Ma'am, here the age of the baby is not mentioned.
Yeah, the age of the baby is not mentioned, but irrespective of the age, it is just about how you can substitute the breast milk, apart from giving food from the remaining seven groups, right? So you can take it as a complementary, a baby who's more than 6 months of age. So since the question asks, apart from giving food from the remaining 7 groups. So
Okay.
yeah, so definitely it is after 6 months of age, but yes, the age hasn't been specifically mentioned. Correct. So yes, 500 ml of animal milk and 2 extra servings of meals per day. So as we know, okay, so how many groups of food are ideal for a child?
8 food groups.
Right. Correct. So among that 8 food groups, one group is breast milk, which needs to be given every day, right? So we know that breast milk is one of those 8 food groups that needs to be given every day, and along with that, the other food groups can be combined based on the introduction of the different food groups. So what if the breast milk is not it's not present, or it's some kids, they do not have access, right? So that is why the animal milk. So as we know, the animal milk is also they have the similar kind of nutrients, but of course it is difficult to digest. But then again, to give that adequate nutrition, a little amount, that is around 500 ml of animal milk and 2 extra servings. So we have learned about the amount of food that is to be given to child at specific age groups, right? So with that, 2 additional servings should be given per day to fulfill the demand for the breast milk, right? So yes, it is 500 ml of animal milk and 2 extra servings of meals per day. Okay, so we'll move on to the next question. The curved colored lines on percentile growth charts show which percentiles? Okay, what about others?
Option B.
Is the B.
Right, option B. So, yeah. So as we have gone through the growth charts, so it is a very methodical way of tracking or monitoring the, growth or the change in the weight or change in the length of the child with specific age, right? So, sorry. We have gone through the growth charts where we have seen the percentile growths. So the percentile growths as to how well the baby is growing compared to the other compared to the babies in the other group, right? And also we have learned about the Z scores. So please go through these growth charts and specifically the milestones as to what are the ideal growth. I mean, what is the mean weight, or which is the ideal height at 6 months of age, 1 year of age, also at birth. So as we have seen that the percentiles are 3rd percentile, 15th percentile, 50th percentile, 85th percentile and 97th percentile, right? So anybody, any child whose parameters they are lying below 3rd or 15th percentile, in between 3rd or 15th percentile, so obviously this is not something which is desired. So that is how the breastfeeding and the complementary feeding and also the the education of the mother and the related people, that should be stimulated so that they exactly know where they are faltering related to the child's growth. So hence 50th it is the the optimal result that we are 50th it is the average or the mean which is being which can be seen, and 85th percentile and 97th percentile, if the values are higher, so obviously the baby is growing very well. So the optimal would be around 97th or even more than that, right? So based on these percentiles, the monitoring should be done as to how the baby is growing and how the food is being given. Yeah, so how the food is being given to the child, whether the mother has the adequate information or the adequate education regarding what kind of food needs to be given to the child, how much should be given, and how many times it should be given, right? So hence based on that, it is also a huge responsibility to educate and motivate the mothers, right? So yes, the answer to this question is option B. Okay, so as I have just said, while you are going through the growth charts, please also keep in mind as to what are the 50th percentile values of the weight and the height at birth, then at 6 months, and also at 1 year for both the boys and the girls, right? Okay, so next question. You want to find out if a child has type 2 nutrient deficiency. How will you do it? Yeah. So as we
Option
have
D.
just correct. So as we have just discussed, yes. So type 2 nutrient deficiency, it is a deficiency of the growth nutrients. So if there is deficiency in growth nutrients, and that will be reflected in the child very significantly, very promptly, right? So as we can see, the option says blood test, urine test, measure and track waist circumference. So obviously blood test and urine test, these are not very helpful metrics for estimating type 2 nutrient deficiency. It cannot be estimated through that, right? So like all the micronutrients that we know, these are kinds of type 2 nutrient, and these are very significant for the growth and development of the individual, right, of the baby. But these are not these are not detectable, or they are not that promptly being detected in the clinical settings, right? So if there is a type 2 nutrient deficiency for a child, so definitely a proper monitoring, a tracking should be done, where the weight of the child, the height of the child, and also the upper arm circumference. So all these are the specific metrics, right? So we have talked about the metrics, the anthropometric factors. So these are important to track the growth of the baby, right? So from the birth to 6 months of age, to 1 year of age, to 2 years, and also to 5 years, so a proper monitoring should be done to see if, at proper like periods of food changes, whether what kind of changes are happening in the weight, in the height, and also in different metrics. So here definitely, if there is a type 2 nutrient deficiency, it is very important that the weight of the child, the height of the child is monitored meticulously, right? So yes, option D is the correct answer, where these are the significant metrics through which we can get to know whether the child is suffering from type 2 nutrient deficiency or not, right? So these are the growth nutrients. This is related to the growth nutrient, deficiency of growth nutrients. Okay. So next question. Baby is nipple feeding. What should the mother do?
Option B.
Option B.
Right. So as we know, nipple feeding is the situation which is disadvantageous for the baby. There might be a higher chances that the baby does nipple feeding, right? So whatever part of the breast comes in front of the baby's mouth, the baby just latches onto it, and there are higher chances that it can be just nipple feeding. So it is very important that correct positioning of the breast is done, so that the baby can latch onto the lower areolar part and there can be a deep attachment, right? And in case there is nipple feeding, the mother shouldn't forcefully pull out the nipple from the baby's mouth, or the mother shouldn't like push or pull the baby's head from the breast, but should gently put the finger in between the mouth and the breast, and it should be detached, and then a proper latching should be done again, right? So the baby shouldn't be pulled out, or the baby shouldn't be forcefully the baby shouldn't be removed from the breast, but there should be there should be a gentle force which should be breaking that suction, and that is how the baby needs to be relatched again onto the breast tissue to get the proper latching at the lower areolar site, right? So yes, in case if the baby is nipple feeding, so the baby needs to be detached and then again latched. Okay, so can anybody tell me what is a very common visual sign to confirm that the baby might be nipple feeding?
Dimple
Yeah,
on the baby cheek.
Right. So dimple or dimpling of the cheeks of the baby is a very potent visual sign that the baby is nipple feeding. So the baby is trying too hard to suck the milk, and that causes the dimpling of the cheeks. So it is very important to educate the mothers also regarding this, that it is not only that when breastfeeding you should also be mindful of the how the baby, how the face of the baby is looking, and what are the different telltale signs to show that okay, there might be chances of nipple feeding, and what is the attachment. So it is also important for the mother to check the attachment. So when the latching has been done, she can gently put her finger and just trace as to how the mouth has latched on properly to the areolar region, right? Okay. So next question, baby is not gaining enough even after starting complementary food. What could be the reason?
Thin consistency.
Option A.
Right. So last session only we have discussed about the learning action protocol, and there we have discussed as to, based on the different ages of the babies, we know that what amount of food needs to be given, what is the consistency, and what is the frequency, right? So these three factors are very important: amount, consistency, and frequency of feeding, right? So if the baby has been started on complementary food at the completion of 6 months, but there might be some irregularities in between these three factors, say the timing, the frequency of feeding is not correct, or the amount of food which is being given, this is also depending on the age, right? So the amount of food which needs to be given to a 7-month-old child, if you give that food to a 1-year-old child, obviously the nutrient requirement will not be fulfilled. So it is very important that the amount be proper, the frequency be proper, as to how many times you need to keep on feeding the baby, right? And most importantly, the consistency. So we know that after the completion of 6 months, now the baby will also start growing the teeth one by one. So obviously this is also a stimulation of the oral environment as to what kind of food the baby can chew and what kind of food the baby needs to be given. So based on that, at every specific age, there is a specific consistency of food that needs to be given to the baby. So it shouldn't be absolutely thin, it shouldn't be very dilute so that no nutrient reaches to the child. It should be of a proper consistency, as we know that there are different kinds of food that has to be introduced and incorporated in the diet regime when the complementary feeding gets started, right? So yes, there might be chances that mothers might say that okay, we have started with complementary feeding, but the child is not gaining weight properly. So hence these are the factors which then again need to be studied, whether the food is being given in correct consistency, whether the food is being given in correct frequency, and also the amount, right? So yes, thin consistency food is given is the correct answer. Okay, we'll move on to the next question. Yes. So mother's expressed breast milk is kept frozen solid in a separate freezer. How long will it be good for?
Option A.
Option A.
Right. So here we are talking about the storage of the expressed breast milk, and it is kept in a freezer. So please go through the sessions that we have done before, and we have specifically discussed about what is the time frame as to how the expressed breast milk can be kept, for how long time when it is kept in the normal fridge, and how much it can be kept when it is kept in the frozen milk, and also if a milk is frozen and thawed, whether it should be refrozen again or not. So if I thaw a frozen milk, should it be refrigerated again?
No.
Right.
It should not be.
Exactly. So whenever we are freezing expressed breast milk, In case we thaw that and use after, say, within 6 months, it should never be refrozen again. So please remember the time frames as to which when it can be used, till what time it can be used, and fresh expressed breast milk, whether after feeding the baby it can be used or not. So as we know, if it has been fed to the baby, it shouldn't be stored, but of course there might be chances of contamination, hence it should be discarded. But if that fresh expressed milk is being properly stored, then if it is stored in the freezer, it can be used within 6 months, right? And if it is kept in the normal temperature in the freezer within 4 degrees, so it can be used within 7 days. So please go through the previous sessions also, and we have discussed regarding all the time frames, right? So yes, 3 to 6 months is the correct answer. Okay, so what is the average birth weight of a boy in kilograms?
Option B.
Yeah, you already indicated that.
Yeah. Right. Okay. So the reason for keeping these kinds of questions is to just let you understand that please go through these milestones, right? So there are a lot of information which you have to go through before your examinations, but these are some specific milestones which are very important in this entire course of growth and development of the baby. So whenever we are seeing the growth charts, so what we are seeing is what is the average weight or the average height of a baby at birth. So that is the reference point with which we are going to monitor, and we are going to see as to how much the growth has happened, right? So it is very important we know the reference with which we are trying to see how much the baby has grown. So please go through the growth charts. Also, how to identify those growth charts, we have extensively talked in the previous sessions. How can we see whether it belongs to a girl or it belongs to a boy, and what stands for, like what will be on the x-axis and what will be on the y-axis. What is the intersection point called?
Plotted point.
Right. So plotted point is the intersection point which will give you the exact values as to, based on the age of the child, what might be the weight and height, right? And please remember in these graphs, for the height is in centimeter, and also remember the units. So height is in centimeter, and for every division it is 1 centimeter. And the weight is in kilograms, and for every division it increases by 200 grams, right? So go through the values of the average weight, average height of both the girl and boy at birth, at 6 months, at 1 year. Okay, so these are the milestones, so please go through it, right? And also, like what is the importance of the percentile and the Z scores. Okay, so we'll move on to our next question. New mother is having trouble with attaching the baby deeply to her breast and getting some milk by day 3 of birth. What could be a possible reason among the following?
Option A.
Option A.
Right. So option A, breastfeeding was not started within an hour of birth. So we have been constantly discussing about initiation of breastfeeding, right? So this initiation of breastfeeding should be within the first hour of birth, that we just called as golden hour, right? So in that first hour of birth, it is the colostrum, or the yellowish thick milk, or the first milk which comes out from the mother's breast, and that is very so that is very nutritious for the child. Now this colostrum, it comes out immediately after parturition, and then the colostrum then decreases within 2 to 4 days, and then slowly the normal milk comes out, right? So as we know, can anybody just recapitulate what are the phases of milk? One we have just said is the colostrum. What happens after that?
Transitional and mature.
Transitional
Transition
and mature milk.
milk.
Right. So
Fore
we
milk and hind milk.
Fore milk and mature milk.
Okay, so we have colostrum which gets reduced within 2 to 4 days, and that is eventually followed by a phase which is the transitional milk, right? And that is followed by the mature milk, and within that mature milk it is the fore milk and hind milk. So how do you understand which is what milk? So the consistencies differ, right? So the colostrum, it is more yellowish in color and it is very thick. The transitional milk consistency will be different, the color is different, and the mature milk is also different in consistency. The transitional milk is more bluish in color, right? And then we have the mature milk which is opaque white in color, and also the contents, the nutritional contents are different. So as we go to the mature milk, we know that fore milk, it is more dilute, right? And it has more of proteins in the fore milk, and the hind milk, it is more thicker and it has more of fats, right? So these are the different components, and this is how the different kinds of milk, they differ in their consistency, their appearance, and also hence it is very important to know what kind of milk is being given to the child at what time, right? Many a times the mother might think that the colostrum is something which needs to be discarded, right? There might be many mothers who think that okay, it is a yellowish thick milk, and it might not be beneficial for the baby. And there are a lot of people who would rather prefer giving some honey or jaggery first to the baby instead of the colostrum. So this education is also important, where we tell the mothers that colostrum is most beneficial for the baby, and this is why, because the colostrum is enabling the baby with the infection fighting components, and all the nutrition is being transferred to the baby through the colostrum, right? So yeah, coming back to the question, breastfeeding was not started within an hour of birth. So as we know that within that first hour of birth, there should be optimal skin to skin contact, right? So that skin to skin contact would also enable the baby to have this instinctive the phenomenon of breast crawl also. So this instinctive movement of the child, that the breast crawl, that will lead to a breastfeeding session, right? So if the initiation breastfeeding has happened properly, so it will make, or it will acclimatize the baby to proper latching. But since in the question it's being said that the new mother is having trouble with attaching the baby, so as we can see, if we go through the other options, that mother has big breasts, obviously this is not it's not a contraindication for proper latching for the baby. Mother is not talking to the baby, no, baby is not hungry. So option A, it is our answer, where it says that breastfeeding was not started within an hour of birth. So this golden hour, or the initiation of breastfeeding, is very important, because it also motivates the child to have that instinctive movement, right? So hence it helps the mother and also helps the child simultaneously to have the to have the breastfeeding done properly. So yes, as you all have very correctly said, option A is the correct answer. Okay, so next question we have, deficiency of which nutrient during the
B.
first 1000 days leads to impaired learning? Yeah, I think
we have already covered it.
Yeah, we have discussed this question. So
Option
yes,
B.
option B, iron. So we have discussed this. There is no substitute for iron, and we know why it is so important. So please read about iron, read as to what are the how the iron can be supplemented, and what can the deficiency of iron cause, and how that can be mitigated also, right? So yes, iron is the correct answer. Okay, we'll move on to the next question. How many food groups should a baby's diet ideally include every day?
8.
Discussed it already. Eight groups.
Yes, we have discussed it. So the question says ideally, so ideally it is 8. So 8 food groups. We have discussed what are these food groups apart from breast milk, be it carbs, be it proteins, fruits, and meat and poultry. So all of these, they constitute the different 8 groups, right? So ideally it is 8 groups should be present, but in case any child is not being able to get at least a minimum of 5 food groups, yeah, very correctly said, 5 food groups. So a minimum of 5 food groups have to be there in the child's regular diet, right? Okay, so yes, correct answer is 8. Okay, we'll move on to the next question. What is the average length of a 1-year-old boy in centimeters as per WHO growth chart? Answers?
B.
I think it is 76 centimeters.
Yeah.
Yeah.
So
86.
76 centimeter, right? So obviously whenever we are talking about the average length, we are talking about the 50th percentile, right? So if anybody is having any confusion, please be very clear, it is the 50th percentile. That means 50% of the child, they are above that, and 50% of the child are below that value, right? So if we are talking about 97th percentile, so 97th percentile means that it is higher, or that child has more, the baby has the value, or the value of the weight or the height that the baby has, it is more than 97% of the other children, and it is only 3% who might have values more than that. So be very clear about the percentiles, and whenever we are talking about the average length or average height, it is the 50th percentile value that we are talking about. So I have discussed before, please be please be mindful of the values at birth, 6 months and 1 year. So yes, the answer to this question is 76 centimeter, right? Okay. So we will just take a little bit of break to discuss something else at the moment, and then we'll get back to the problems again. So okay, so somebody had asked to discuss about the IMS Act. So as you can see, the IMS Act is basically the Infant Milk Substitutes, Feeding Bottles and Infant Foods Act, right? So basically, if you can, I'll just show you. Okay, so just for your reference, if you go and click on this IMS Act, I have attached the document. I will just let you know in some time. So if you click on this IMS Act, I have attached the document which has been compiled by the Breastfeeding Promotion Network of India, or BPNI, and this has got a very detailed information as to what the act advocates and what would be the violations of this act, right? And we have also discussed a question as to what is a straight out violation of this act, and that would be advocating all these food substitutes for children below 2 years of age, right? Because till 2 years of age we are advocating complementary feeding, and it is through proper meals and proper food that the child should get the nutritional requirement. It should not be the milk substitutes, or it should not be the artificial supplementations that need to be given to the child within 2 years of age. So hence these are the violations. So as you can see, this IMS Act, the highlight would be to prohibit any kind of promotion of infant milk substitutes, feeding bottles and infant foods to protect breastfeeding from commercial influences. So as we know, there are a lot of companies who keep on advertising their milk substitutes and milk food, and they say that okay, this is so much high in this much nutrient, but obviously we know that breastfeeding is the goal. I mean, it is the it is the golden fluid, right? So breast milk. So there is nothing that can substitute breast milk. So this act, it actually prohibits these companies to promote any kind of these substitutes. Also, they advocate and they educate. The highlight is to educate pregnant women and lactating mothers to create the awareness, because there might be mothers who would prefer to just mix the very famous brand names that we know, Cerelac, Lactogen and all of that, and maybe they would just feed that. But it is also very important that we educate them that once your baby is at that bridge of 6 months of age, now the complementary feeding needs to be started, and these are the common food that is available with you which can be given to the child, right? And once the child now reaches 1 year of age, it can be easily the food that the entire family eats, that food can be easily given to the child. So also, this act, it restricts and controls the use of infant milk substitutes and infant foods, right? So as we have just discussed, the violation, how there can be a violation of this act. So if somebody keeps on advertising or the use of infant milk substitutes and infant foods, so this is also restricted under the IMS Act. And the IMS Act also defines the roles and responsibilities of healthcare institutions and health workers. So it is very much important that any professional, any healthcare professional should not advocate these kind of, food substitutes to mothers to be given to their children. So as you can see in these images, you can just go through all these pointers, which very clearly says that what are the exact violations of the IMS Act, right? Okay, so for anybody who's interested to read more about this act, so as I've just said, you can go to this IMS Act link, and if you click on that, so yeah, so if you click on that, the document that I was talking about, you can access that document, and here section specific, there has been specifically written like what are the different what are the different sections under this act, and what would be considered as a violation of this IMS Act, right? So somebody was asking, I've forgotten the name, who had asked about the IMS Act details. Yes. So is it okay? Maybe you can go through the documents, right?
Yeah. This is really useful. Thank you so much.
Yeah. Okay. So, okay. So maybe I'll just stop sharing this. Yeah. Is my slide visible?
Yes, ma'am.
Okay.
Yes.
Yeah. So as we have just discussed, so you can just go through the document, and if you are really interested, you can get all the information through this, right? And also from the examination point of view, just remember that all these substitutes, they are totally banned for use till 2 years of age, because the complementary feeding needs to be advocated, and the mothers need to be motivated, they need to be educated first, and then they need to be motivated that this is what you should follow. You shouldn't be giving tea or coffee to your child. You shouldn't be giving more of sugar rich diet or salt. So all these things are also to be kept in mind, and these information need to be passed on to people who do not have the privilege to get to know these information, right? So it is very important that we tell them that if you want your baby to grow well, so these are the things that you should definitely follow, right? Okay. Yes, somebody has raised a hand.
Yes. Just wanted to ask, at what age is tea or coffee recommended to kids? I mean, I can't say kids probably. I mean, I don't know how. After what age can someone drink tea or coffee? Recommend it.
Okay, so ideally, it should not be given to a baby, it should not be given to a baby, and there is no specific age. No, I think I have shared this in one of the slides where I was talking about the restriction of caffeine foods. So if you go, I think it is 11 years, most probably it is 11 years, and it's. I have forgotten the source, but I remember it is there in one of the slides. So maybe you can just skim through it. It is there in one of the slides. Most probably it is 11 years, which has been advocated by the American Association of Pediatrics. Most probably 11 years. Yeah. Okay. So, is there any other question related to the topics we have covered? Yeah, exam questions will be multiple choice.
For the exam, for the questions that has something related to growth chart, so will we have the access of the
No,
growth chart also?
you will not be given the growth charts, but as I have said, please go through the milestones, right? So please study what would be the average height or weight at birth, 6 months of age, 1 years of age, like that, right? You can just build your concept that way.
Okay.
How many questions will be asked? Okay, I think it is 100 questions. Okay. Okay, so I'll
Can we
just,
actually
yes.
submit? Before we submit, can we actually go through all the questions and answers over again?
I am not really sure about the interface, but maybe, I mean, you can go through the answers. I think the interfaces are like that only usually. So, I mean, I can't.
Every single question has some particular timing. It's not like that, no?
Sorry?
Every single question needs to be answered in particular time. It's not like that, no? Overall timing, right?
Yeah, it should be the overall time only. I mean, it's same like that, yeah. Okay, so somebody had some other questions. I'll just quickly go through it, and then we'll move on to the next part. Okay, go green. I am really sorry. I cannot do anything in this. Maybe you can just get in touch with, NPTEL. I mean, regarding writing the exam and the exam centers, unfortunately, there is nothing in my hand, right? So I would suggest you that you please, yeah.
Ma'am, I thought it was online exam. From home I can write the exam, but right now after seeing the hall ticket, I got to know that I have to write in center.
Right. So, I mean, there is nothing in my hand. That is what I'm trying to say. But you can just, I would suggest you get in touch with, the staff of NPTEL who have been communicating with you, and you can let them know your issues, and then maybe they can give you a solution as to how you can take the, certification exam. Right? Okay.
But NPTEL was not answering. I
Yeah,
emailed that,
yeah,
but
I
they
I
are not
understand that. I understand that because they might be getting a lot of queries, so they might take a little bit of time to answer. Yeah, I understand your issue as well, but unfortunately, I don't have any hand or say in that. I'm sorry. Yeah,
Okay, ma'am. Thank you.
yeah.
Today's question that we discussed, can
Sorry.
you share that?
Can you repeat?
Today's question that we discussed,
Mm-hmm.
will we get the access to that? Will you be sharing that with us?
Yeah, I'll be sharing I'll be sharing the PPT as I share. Like we, shared the problem solving sessions. So you'll be getting the recorded lecture. As I shared the other lectures on YouTube, you'll be getting the recorded lectures also. Right? So for the exam,
I couldn't get
yeah,
I couldn't find the YouTube link.
you couldn't find the YouTube link.
Yeah.
You go to the problem solving session Excel sheet. All the YouTube
Okay.
links are there. Okay.
Okay. Okay. And
All the
today's
YouTube.
session will be
Yes.
tonight, right?
Can you?
Today's session will be uploaded tonight or
Yeah,
tomorrow?
yeah. I'll try to upload it tonight only. Yeah. So you might just get
So
it.
because
Yeah.
in my date as exam.
Yeah, yeah, yeah.
That's why.
Yeah, I'll try to upload it tonight
Okay.
only. Maybe it might be a bit late, but I'll try to upload it. Okay.
Okay.
And
Okay.
I would just suggest go through the sessions, go through all these questions that we have discussed throughout all these weeks, and also your assignments. I think that should be fine. Okay. Somebody has raised a hand. Please go
Yeah,
ahead.
ma'am, I wanted to know there are two sessions now, like on Tuesday,
Yeah.
6 to 8 and 7 to 9.
Right,
So
right.
my question is, do we discuss same kind of questions in both the sessions? Should
Yeah,
we go
yeah.
through the recording of both the sessions?
If you want, you can go to the recording of both the sessions, but the thing is both are being taken by PMRF TAs, and we follow a similar kind of format of discussing questions related to the week's content. So definitely if you are interested, you can just skim through both the both the videos and both the material. It is all there for you people, so just utilize it as you want, right?
Yeah, actually, because there's limited time, so I wanted to know if there are different kinds of questions discussed, then there is a point in going through all the recordings. But if
Okay.
same kind of questions are discussed, then we can only go through your sessions.
So the thing is, both of us, we follow the same kind of formats, which has been given to us by NPTEL, but it also depends on the TA as to how they would like to cover the topics, right? So if you want, if you are interested, you can just go through some of the videos that the other TA has uploaded, and if you want, you can just go through couple of videos, right? And then you will get a hang as to what kind of questions are being discussed. So depends
Okay,
on
ma'am.
you. Like, knowledge is there everywhere. Just get it how much you want. Okay. So where will the recording be uploaded? Okay. So again, just discussing about the recording. I've been telling this since many sessions, but just to emphasize on it, if you have been shared a problem solving session tab on your Swayam portal, right? So if you go on that, you will be directed to an Excel sheet where you will find the names of both the PMRF TAs who are taking sessions for you, right? So one is Miss Amrita, and another one obviously I am taking. So both our names are there, and you can find the YouTube links of all the weeks that we have taken your sessions, right? So you can go through the lectures and also the slides that we have used to teach you people. So those are also there in the specific folder links, right? So you can access any of it, and also even after the completion of the course, you will be able to access the content. So there is no issue in accessing the content, right?